305 Fights, where champions rise.
This is Dr. Michael Jimenez here at Jimenez Med Spa. I'm here with Elio, and he was gracious enough to allow us to do a recording on his treatment today. So, a little background with him. He has some knee concerns. Many years of hurting himself, doing martial arts and training everybody. So he's suffering some knee issues. So I'm going to do a little rehab for his knees, something really quick and easy. First, we're going to sit back a little. I'm going to loosen you up. Using the hypervolt, so go ahead and lay down, and then we're gonna get into some body work, okay?
And usually those muscles there, they get tight and cause an effect on the knee?
Definitely, so right now we're working on the quadriceps. Quadriceps usually don't have a lot of issues, simply because it's such a large muscle. But what happens with the quadriceps, there's a lot of fascial connection with the IT band on the side. It runs right here.
Yes.
And the actual quadriceps. So we want to get in between those two large muscles and break up those adhesions. When you see the hypervolt jumps like that, that's because you have scar tissue. So when you see that bouncing, that's scar tissue. Yeah. So we need to kind of loosen that up, break it up, get everything functioning correctly, so we can do proper strengthening and stretching. Okay. I like to do just a couple minutes of this, just to get the blood flowing before we get into the actual body work. Cock grip instruments, the type of instrument assisted soft tissue. So I use them, they're all different shapes and sizes. With him, we're going to use this one, just going to scan the area, and then we're going to get into the individual muscles with this one. They're just a type of soft tissue. I'm able to get in there deeper than just using my fingers, and kind of smooth out all that scar tissue in between those muscles. This is just water-based. It's like a water-based lotion, just to so we don't damage the skin when we do the treatment. All right, so you're gonna apply some resistance against me here. So we can do this with different. This is just an isometric contraction here that we're doing. But you can incorporate this with doing squats, you can do it with doing weights, elastic bands, anything you name it, we can kind of combine it. Okay, you're gonna bend your knee.
Yeah, it's funny, I've had this done in China by Chinese doctor, but they didn't combine it with the isometric or isotonic exercise. And I like how you combined it with the massage gun.
Yeah, so I mean, in China they use something called gua sha, okay, which is very similar. And then instead of metal instruments, they use jade, kind of get that energy, the traditional Chinese medicine with energy. And but basically it's the same concept. You're increasing blood flow, you're stimulating muscle contraction, kind of integrating that nervous system into the muscle contraction and the movement of the leg. Getting here in the tendon. Do you see how red he turns here? This is the source of all the scar tissue right here. So if I were to go any deeper here, he could bruise. You know, see how red he gets? That's because there's a lot of scar tissue in this area right there. Up here, not so much. See? Okay, let's get the other side.
Excellent.
going as hard on this side, but you see not as much scar tissue. So even though you've had a little bit more pain on this side, you can tell that it's not as bad as the other side. Should I bend? Good. Good. Get a little deeper with this one now. So these specialized instruments, they have bevels, different angles that I use depending on how deep I want to get in there. So this one with a very sharp bevel, it gets nice and deep into the deeper muscle layers, okay? Kind of separates the individual muscle layers, fascial layers. There you go. Feel that, right?
Yes, sir.
Good. But see, I'm going even harder here than I am here, and you don't get as much of the redness, the discoloration, simply because this is a healthier tissue, even though you compensate more with that side. So we know that this knee needs a little bit more work. And we talked about other treatment options like PRP, stem cells. You start getting those repeated injuries into the joint, which causes degeneration. Then we got to do more invasive procedures to repair that.
Let me ask you, doctor, do you find it better to combine modalities like you did with the massage gun and then with this therapy?
Of course. Anytime you combine different modalities, you get a better result. Because you know, it's not the same if I give you a deep tissue massage versus me kind of heating up the tissue first, doing heat, maybe ultrasound, kind of get that blood flowing, and then going into the deep tissue.
Yeah.
So
I feel like when I get the massage and the heat before the adjustment, it feels better. So I can feel that the different modalities are good.
definitely. You want to always combine the modalities with physical therapy, chiropractic, acupuncture. You always want to combine different modalities to get a better result.
And of course, at home, eat better, exercise, all that is combined, right?
Definitely, nutrition is number one. Any type of training, your muscles need the proper nutrients. So getting those macro and micronutrients are important. So lifestyle, diet, supplementation is always good.
Awesome. Thank you very much.
Okay, thanks again. Stay tuned.